If you have patients who have back spasms and you're just stretching them or rubbing it or adjusting them and the spasms just aren't going away, meet my patient Mike, who has had back spasms for 6 months, and he gets it when he rotates his thoracic spine, just like swinging a golf club. What he didn't realize, and I didn't realize until this visit, is that he had a giant scar from the lipoma he had removed 6 months prior. So check it out as I remove the adhesion and get him results and symptomatic relief in real time.
So last time we were here, we worked on this area, just a lot of stuff in the belly on the right side. How is this side doing?
Good. I mean, I did some, exerted myself over the weekend, and so, it was stiff for a couple days.
What did you do?
Just pulled out some, annuals around the yard. And it took, almost 2 hours to get here, so it's a little stiff, but...
And then 2 hours driving here?
Yeah.
How long were you picking flowers for?
Probably an hour.
How stiff are you right now from after driving?
2?
In this spot right here?
Yeah.
Have you stood for 30 minutes or so?
Generally, yeah.
And
That's fine.
how long do you need to be standing for until symptoms increase or come?
Standing doesn't really bother me.
Huge.
Yeah.
And how about sitting in office?
15 minutes.
And how bad is the symptoms after 15 minutes?
Like a 2 or a 3. The longer I sit, the worse it gets.
But right now you have a little bit of stiffness right here because of after driving.
Exactly.
Last time we were here, you said you're about 80% better overall. Are you still about 80% or a little less, a little more?
No, it's not the same.
Good.
Like I said, I can aggravate it.
If you lean back like this, does that make it worse?
Yes.
How intense?
3. It just spreads out. It goes all the way across instead of just in the point.
3 out of 10, the whole lower side of the low back.
Exactly.
So today we're going to do some thoracic stuff to help with your stability. Have a seat. You're going to hold this PVC pipe across your chest like this. That looks good on you.
Thank you.
You're going to have your feet and knees together. Good. And I'm going to tell you when to rotate. So just rotate your upper body to the left. Go ahead. Good. What do you feel?
Just a pinch down.
Point to me.
Right here.
Oh, on the spot.
Yeah, in the
How
spot.
intense is the pinch?
5.
5 out of 10. That's a chief complaint. 5 out of 10 pinch, and the range was at 42 degrees, 76% function. Good job. I'm going to do the other way. When I say go, go ahead. Try to keep those feet and knees together. What do you feel here? Right here?
Yeah.
Pinching, achy, burning, stabby, throbby.
It's locking up, like spasm right now.
Like right now, that's why you have to get up.
Exactly.
Pay attention to that spot where he has this locking up feeling. Mike had a lipoma removed right at that spot. When I asked him, because it felt like it was glued down to the intercostal muscle, which is deeper than the lat in that spot, he was like, yeah, the doctor said the lipoma was very deep. Sometimes when we have surgery and a lot of scar tissue from the surgery, it can cause a symptom like this for Mike when it's locking up. And he's also a golfer. So imagine being a golfer and you're trying to twist to get your golf swing to go back, and he's just locking up. That's going to overload his low back. Something I wanted to let you guys know about is our free 5-day Find, Feel, and Fix the Worst Spot for Chronic Sciatica challenge that you can find by clicking the link here. This is a mini course on how to feel nerves, the biggest nerve in the body, how to see if it's stuck by adhesion or if it's swollen or entrapped, how to set up to generate tension on it, because it's tension that actually breaks adhesions, and then how to do a treatment pass even if you don't have an assistant. The idea with this challenge is that I wanted hardworking providers, chiropractors, massage therapists, physical therapists, naturopaths, osteopaths, whomever, who want to fix a very common problem where people have chronic symptoms and aren't seeming to get relief. Usually the primary cause for that is adhesion in this spot. So if you go ahead and do this challenge, the idea is that you would be able to go and help them get 10, 20, 30, 40% relief in 1 to a few treatments. And then you might be interested in talking to us to apply and see if you are qualified to become an Adhesion Release Methods provider.
You're gonna have a seat facing straight ahead. And you're gonna put your head down like this and you're gonna slouch. Put your belly down. Good, not that much. Good, right here. Do you feel anything when you do this?
No.
Are you shaking?
Me? No. Not intentionally.
1, 2, 325 inches flat.
When someone says that they're shaking, or Casey witnessed Mike shaking, I'm thinking that the body is trying to get off of a tissue that's being loaded a significant amount. So the shaking is his body saying, get off me, stop. And Mike's a strong dude, so he's able to just sit through that. But that's what I think when I see or hear somebody shaking.
Okay, going up. What'd you feel doing that?
Nothing. I may be a little unstable. Like you said, I was shaking a little bit. Maybe I just didn't have my feet far enough forward.
You felt unstable,
Yeah.
but no symptoms or
No,
tightness.
exactly.
Leo, thank you so much for
What's happening? Of course. Absolutely. Yeah. How you doing?
Well, I'm excited for Thanksgiving and a few
Yeah.
days off. How about
Nice.
you?
Good.
Yeah.
Yeah. You know, getting on a plane on Saturday, so.
Of course you are.
Yeah.
You got work to do.
Exactly.
Just don't stop, okay? Just
Yeah.
make sure you don't stop.
Yeah, exactly. As soon as I stop, it's all over.
You just drop down dead.
That's it.
I get it.
That's what I'm worried about.
Come have a seat right over here for me, please.
Sure.
So when you turn to the left, you feel this spot here? You
What?
feel it here.
Yeah, it just locked up there. It just went into spasm.
When you turn to...
That's to the right.
Oh, when I turn this way, yeah.
He wants to
What's
know
the
when you
scar
turn.
from?
Huge lipoma.
You were pointing right at it. Did you realize that?
No.
Do it again. Turn to the right. You're pointing right at it.
Huh.
Okay. Cross your arms across your chest. I'm going to do... When you went to the left, though, you felt it down here.
Yeah, I feel like that.
Okay. Let me see what's going on over here first. The thing about surgeries and scars is they form scar tissue, pretty much no matter where they are. It's more common to form scar tissue deep to the skin in the muscles and the connective tissue than it is to not have scar tissue. Usually you should be able to move the skin back and forth, which implies that the skin is not attached to the underlying tissue. But if a provider takes that skin and can't move it around, or if someone like me puts their finger in there when you try to stretch in a certain way and it pulls very tight, it implies that that adhesion or scar tissue needs to be removed in order to restore that functional range of motion. It's important to get your adhesions and scar tissues checked so that they can be removed. Yeah, they got, this feels like they got into your intercostals a little bit.
Yeah, once he rotates to the right, start to spasm, and you have to get up.
To the right?
Mm-hmm.
Yeah.
In that area.
It's shaking. Huge lipoma, huh?
It was funny because it was big on the surface, but it wasn't that big. And then when he took it out, he was like, holy cow.
It was deep.
Yeah, it was
That's
like
why this
chicken
is
cutlet.
going to the ribs. Chicken cutlet?
Chicken cutlet.
You know what? I know what I want to do. Lie on your side, facing Greg that way.
All right.
We're going to do a bit intercostal on...
It's funny because the dude was like, you don't need to get this removed. I was like, I know how this goes. They don't get smaller.
They keep getting bigger.
Yeah, exactly.
They can't be cancerous, can they?
Not the kind I had, but they biopsy it. Probably just to charge one.
That's right. That's right.
Chris, are you working at the back and the front?
I'm working right here.
Okay.
Where the scar is. And I want to, you're going to bring this leg forward. Good. And then Casey, we're going to pull. Go ahead.
I sound like a voice actor.
He does. Like Batman.
Yeah, I can see Batman.
Lego Batman.
I see you saying yes.
Absolutely.
That's hilarious.
I was like, if you want, you can be Batgirl or Catwoman, but I am Batman.
That's right. Put him in his place. Because they took the lipoma out and he said it was very deep, it went all the way to the intercostal, so when he turns to the right it cramps and spasms a little bit. So I'm treating the intercostal muscle that has a lot of adhesion inside of it. I'm going to do one more pass. Go ahead. And it's pretty stiff. I'm going to have to use my whole body weight. Good. Coming up, my friend. Slide over that way. So, Casey, right T11 intercostal muscle at scar. Arms across your chest. Turn to the right, please.
Mm-hmm.
How's that feel?
Good.
Come on back forward again. Do it again. Still spasming a little bit.
Ask hard, right?
Nothing like before,
Moderate
though.
to severe. Nothing like before?
Yeah, because it locked up. I literally had to stand up.
This was better.
Yeah, a lot better.
If it's still spasming or locking up, that usually means that all of the adhesion hasn't been cleaned up. So while Mike seems happy with that type of change, I just know that it needs to be 100% for the spasming and locking up to not be there. Because if there's any spasming or locking up, even when he goes back to play golf, maybe he'll be able to play 1, 2, 5, 10 rounds. But at some point, that spasming and locking is going to get worse. So every little bit of spasming and locking up has to be cleaned up so that he can go back to golf safely, which that's his goal 4 or 5 months from now when spring comes, because winter is here. 50% better. 80% better.
Yeah.
I'll take it.
Rotation to the right.
Yes, 80% better rotation to the right at the scar.
Mike, how long ago was that removed?
6 months.
Okay.
6 months ago?
6 months, yeah. Wasn't that long.
You were playing golf after that removed?
No.
You haven't played golf since then?
No.
Because of that or because you're
No,
back?
because
the whole
of the
low
back, yeah.
But next summer we're going after it, right?
Exactly.
Okay, cool. Yeah, Casey, we're gonna. You can help me a little bit.
Wait, want the table lower?
Sure. Yes. Greg, you want to hit that? Well, Casey's got it.
Yeah.
Rotate in the lateral flex.
I think that's rotation.
I can hold it, then you can use your other hand. Maybe.
I'm with you. This is. I'm in the right spot. All up in Mike's personal space. You probably don't let anyone get this close. This is how we artificially hug people, Mike. So much oxytocin right now. Okay, Chris. 10x oxytocin. 300 scar Casey. Arms across your chest. Rotate right, please. You said 80% before. Worse or better?
It's better.
90?
Yeah. Like, I feel it's there, but it may just be recovering from the original spasm,
From
you
the
know?
sore.
Yeah.
The first few passes on the scar, I did my hands because I thought that I was going to get better treatment faster in cleaning up thoracic rotation to the right. And I think I did 2 treatment passes and he was 80% better. I wasn't convinced that more treatment with my hands was going to clean it up more, so that I just tried the shockwave machine, the radial shockwave machine, which saves my hands. And then I did one pass on his TL joint capsule, and he said he was just sore after that. Part of Adhesion Release Methods, step 4 of the 6 steps, is picking the best tool for the job. The best tool is the tool that removes the most adhesion. Is it our hands? Is it the radial shockwave machine? Or is it the grip bar? And we need to pick the best one, because so many providers, they have just instruments. They use just Graston, or they use just active release technique, or they use just radial shockwave. Well, our whole argument with Adhesion Release Methods is The best tool is the one that removes the most adhesion the fastest. And that's the only way that you get patients more, better, faster.
Chris, do you typically see adhesion form around surgery areas?
All the time, dude.
You get the same thing with the gut, right?
Especially abdominal surgeries, C-sections, hysterectomies, tummy tucks. What did you have in your gut? Appendicitis?
I had my colon resection.
That's why Mike had a lot of stuff in there.
It's funny though, I do call it my C-section scar.
That's hilarious. Yep, perfect case. Good. Rotate right again, please. You said 90 before?
Yeah, it's good. Like I said, I just...
You just feel sore.
Yeah.
Okay.
Exactly.
T11, T12 joint capsule. Monitor it. Cool. Come on this side, facing this way, because we're going to go the opposite direction. Cross. Yep. And rotate left. 0 to 10 here.
It actually feels all right.
Give me a
Call it
number.
a 2.
2. Was it 4 before or 5?
5.
Yeah.
Pinch.
5. Okay. You can see that you clean up right rotation, and then you go back to checking left rotation, where he had 5 out of 10 pain at his left PSIS area, and that became a 2 out of 10 pain at his PSIS area. So restoring function in one range of motion can often affect another range of motion, and this is how the body's like a puzzle in a machine, that you fix one part and it affects other parts, which is really cool with the fascial system.
Where I feel it here, it's like in the exact same spot.
You feel it up higher now.
Yeah.
You feel it more here than here.
I do.
Good job.
I was gonna say that's different.
It is different. We want it to be different.
What's that you're poking around in?
I don't know yet, Greg.
Oh, all right, my bad.
His back.
That's right. This is a back.
It's different from the front.
That's right.
Fingers in there.
That's right. Okay, rotatories. Sit up tall. There you go. Good. It's better. One more case.
Sit nice and tall for us, Mike.
There you go.
Want me to help you, Chris?
That's okay. Good. T, 1, 2, 3. Left T6, T7 rotatories, rotate to the left. 2 passes, moderate to severe. You still feel this up here?
No,
You still feel this down here?
a little.
2. Still.
Yeah, 2.
Rotatories and multifidus in the thoracic spine are stabilizing muscles. They go sideways like this or up like this, usually up 1 or 2 or 3 levels, and they're really important when it comes to stabilization but also rotation. So if somebody is having trouble rotating, we check the thoracic joint capsules, the intercostal muscles, and rotatories, multifidus, and this is typically how we will restore thoracic function.
What's 2 out of 10? PSIS?
Yes.
I was looking at it the other day. I was like,
Could be T12, but it's more likely to 0.5 is one of this.
What is that you're looking at?
This is a sclerotome chart. It's just when a disc or a cartilage or a joint from our embryological origins. These are certain patterns that when the L3 is triggered, it typically will produce a pattern in some type of expression like this. So this tells us when the joint or the cartilage, it's called a sclerotome, is overloaded. Not a nerve, It could be a nerve root, but not typically a peripheral nerve entrapment. When it comes to diagnosing patients correctly, we have 10 diagnostic categories. 5 of those are local and 5 of those are referred. So when we diagnose people and we know a patient points to their location of symptoms, what adhesion release methods providers are taught to do is to localize where that symptom is and figuring out, is this a local tissue, is it a referred pattern, and what is the referred pattern? Is it the sclerotome? Is it the dermatome? Is it the muscle trigger point? Whatever. Because when you have this diagnosed correctly, it's much easier to treat it effectively and get very fast results immediately within the visit that lasts from visit to visit. So this is why the sclerotome chart's in there. It's helpful for me to look at every single day, but also for patients to realize the reason why they haven't gotten permanent relief yet is because somebody hasn't figured out their patterns and somebody hasn't been able to treat the cause of their symptoms that they're having. Just because my body as the doctor is in the same position every time we're treating somebody's abdomen doesn't mean that we're always treating the psoas, because a lot of people will comment on, especially Instagram where I see it, oh, you're treating the psoas again. There are at least 10, if not 15 to 20 different structures right where it looks like we're treating the psoas that can be affected. And this is part of the precision that is adhesion release methods, is every tissue feels different. You find these tissues in different locations in the abdomen. Just because the abdomen goes from the rib cage to the pubic bone does not mean that every tissue there is a psoas. It's not physically possible. There are specific nerves in the area and specific muscles too, psoas iliacus to QL. Specifically the nerves that just need to be localized in order to see if they're stuck. People always, you put your hands in here and everyone's like, oh, you're treating the psoas. Well, there's all kinds of stuff. There's the femoral nerve, there's the LFCN, there's the iliohypogastric ilioinguinal up here, there's stuff down here, femoral nerve, iliohypogastric wraps around, there's a lumbosacral trunk, and there's a nerve roots medial to the psoas right next to the abdominal aorta. So this is a spot that you need to get like really deep in here, and you can feel if the nerves coming out this way are stuck and irritated. He's doing so much better. He's 80% better, but he was picking darn flowers and weeds for an hour, and then he regressed back to 80%. So I need to find where the secret adhesions are that are still preventing his core from stabilizing so that his low back doesn't get overloaded. So I'm in his nerve roots. This doesn't feel great, but he's a tough guy. Go ahead. Good.
Mike, what do you do for a living?
I'm a lawyer.
What kind of law do you practice?
Maritime.
I have never met a maritime lawyer before.
I'm a unicorn.
That's pretty cool.
Are you?
There aren't a lot of us.
Why? Because you don't need many.
Yeah, exactly. And because it's so esoteric, like no one
It's
goes
esoteric?
to, yeah, nobody goes to law school
To be a
to
maritime
be a
lawyer.
maritime
Yeah.
lawyer.
How'd you get into it?
Went to my firm. The guy who was doing it was like literally the best in the world at it.
Really?
And I was like, well, I can learn from this guy,
That's
and then
how
I'll
you
move
learn.
on and do something else.
And then you started crushing it.
And then
Go ahead.
25 years later, I stayed.
What's fun for me as an adhesion release methods provider is treating people like Mike. And I just want to bring this attention to the other doctors and therapists, because my whole goal with adhesion release methods is that we take the top 5% of manual therapists and we make them the best in the world. And when you're the best in the world at what you do as your skill set, you tend to attract other people who are the best in the world at what they do, whether it's lawyers or dentists or nurses or accountants or whatever. And Mike is saying that he learned his skill set from another lawyer who was the best in the world at this maritime Popeye type skill set that he had. And that's really fun for me, because sometimes you can feel really lonely as a doctor or therapist who's really trying to excel, because if it was easy, every doctor or therapist would do it. And so it's important for other hardworking doctors and therapists to first excel your skill set, but then to start to attract other people, whether it's your staff or it's your patients, who are pushing their fields so that you can be surrounded by that type of energy. That's something I don't think I've ever talked about before, but Mike was just talking about his skill set, and I just wanted to throw him some kudos, because these are the types of individuals that typically inspire me in a different way than our patients who are suffering a lot of pain to be better and do better. So, at the end of that pass where you saw me trying to hang on to that tissue, I said I didn't like it. So I'm choosing a different vector going the opposite direction in order to try to get a better treatment pass. If you don't feel the adhesions being torn out or pulling tight, then you're not getting effective treatment. Good. Come and sit up, brother. Left L2 nerve root, medial psoas, moderate.
Giving you a workout.
It's good. I like it. You gotta keep me going.
I really
Rotate
make it
this
work.
way. Still feel 2 here?
No.
Gone.
Yeah, it's better.
Okay. Let me just check your low back. Come on all fours, please.
Left L2 medial to psoas moderate.
Thank you. Mike, come on down here, please.
Going
Knees, chest,
lumbar.
face. When I say go, you're gonna crunch all the way up, okay? Go ahead, Mike. Whoa. Good. Left L405 joint capsule. Go ahead. That's better. Good. Relax down.
Mm-hmm.
Go ahead. Moderate. Okay. That's better. Crunch up. Good. Right side, L405 joint capsule, moderate. Crunch up. Good. Casey's gonna remeasure. How are the dead bugs going?
Oh, good.
You
Yeah,
don't know?
yeah, and I've been straightening my legs because I didn't know I was supposed to. So.
Okay,
Yeah, I can do it, so that's fine without pain.
Without, okay.
Yeah, it
great.
doesn't like aggravate it or anything. So
Okay, huge.
I'm doing it. Yeah,
Just continue taking it slow, and then
Yeah.
you want to keep progressing that.
yeah,
You're doing the other exercise too?
yeah. The Jane Fonda's.
Jane Fonda's,
Yeah.
nice. Are we doing the hip lifts yet? Yes, we
Yeah.
are. The hamstring bridges?
Oh,
where you're on the
I
ground
put
and
my
your
feet on the thing. Yeah, exactly.
Okay.
And I don't have a problem with that either.
Okay. We're doing very well.
Cool.
Especially an hour of picking flowers or weeds or
Yeah.
whatever, that's huge.
And like I said, it was sore, but it went away. You know, which
Amazing.
you know, I was home alone for a weekend. I had to do something.
Yeah,
I know. Going crazy.
So yeah, we're gonna measure rotation on both sides. Oh, I want to max that out at 55 degrees for when golf season does come back.
Right.
And then depending on how your low back's going, I may want to get into your ankles. Probably ankles might be next.
They're all shredded.
Um,
Torn ligaments in both,
Yeah.
like all the way through.
Yep.
So,
Okay. Well, this is gonna be fun.
yeah, it'll be good. All right. Happy Thanksgiving.
And thank you so
Thanks,
much
brother.
for
Of
that.
course.
It really means a lot.
Absolutely. Yeah.
Very much.
All right. Let's see if we set it back off.
Just rotate to the right first, okay? Go ahead, rotate to the right. What do you feel here?
Just the stretch. It's good.
Where's the stretch?
It's
In the same spot.
yeah. Exactly
How intense is the stretch?
3.
3. What do you feel here?
Stretch. Same place.
And back here in the bottom?
Yeah. No. Up high.
How intense is the stretch from 0 to 10?
3.